All right, good morning. This is John Decker, the Director of Community Services. It is at Alta California Regional Center. It is 11:03 on Friday, and it is April 22nd. We're doing Coffee with Community Services. We've got 43 participants on, and we'll introduce some Alta staff that we have on today, since we don't have a guest speaker from DDS and a whole crew of folks on. So we've got some folks from Community Services here. We've got Odelia, good morning, and Shirley, and Gary, and Heather, and we've got Jason and Scott, and my assistant, Zach. Good morning, Zach. And we've got some of our case management staff. We've got one of our service coordinators, Bailey, on here. Gary, I don't know if I said hi to Gary this morning. Gary's on here as well. We've got some of our managers on here. So Rowena is on here, and Christina, good morning. And Dana, as always, a faithful attendee here with us here for Coffee with Community Services. And then we've got our CSS managers as well. We've got Gino Nessie, and we've got Olivia Procida. So good morning, folks. And Carly, did we have you at our meeting last week? I'm trying to remember.
Yes, I was here last week.
Yes, awesome. So you guys had an opportunity to meet our employment specialist. Carly is diving fully into this job as employment specialist. She's got a lot of folks around her in the community services department to support her, but I can tell she's certainly going to bring a lot to this position. And so we're looking forward to it because, as many of you are aware, employment is one of our large strategic focus areas for the strategic plan that our regional center is developing. And so Carly is certainly going to be playing a big role in this. So welcome everyone today. Again, we've got about 45 folks on, and we're going to be talking about a few different things. We're going to end a wee bit early, I believe, because we have a public meeting that we're hosting at noon that some of us are going to have to jump over to. So we are going to go over a few different things. We're going to talk about the rate study and what's going on right now with the rate study and kind of what's coming up next. We're going to give you, as I mentioned, we have been holding some public meetings related to the closure of Training Towards Self-Reliance, or TTSR. So we're going to talk about that a little bit. We're going to discuss upcoming vendor forums. We're going to talk about some other advocacy things that are going on with the California Dental Association, and we'll talk about what we're going to be having as far as some upcoming guests for future Coffee with Community Services meetings on Fridays. Many of our like our Director of Client Services and some of our Associate Directors, I believe, are in the statewide ARCA Directors of Client Services meeting this morning, and so they're not able to join us today. As always, if there's anything that you want to ask, you're always welcome to unmute yourself. You can certainly put information in the chat as well. So first and foremost, I think it's good for us to start off with, and look, Kate has joined us as well. So we will welcome Kate here. Another one of our community services specialists. So in talking about the rate study, we have been putting in many, many long hours in our community services department and our accounting department in working on the rates and ensuring that the rate study implementation is done accurately. It has certainly been a challenge. I think it was described yesterday by some directors of community services as 6 months of work in 6 weeks. And I think that's a pretty accurate definition of what we've had to kind of go through to get things prepared for the rate increases. With that being said, I was told this morning that we have, at this time, no rates to release to anyone because we have not received the finalized rates yet. So I don't know, we've got like 8 whole days until the vendors are supposed to start billing. So what do you think, Olivia? Are we optimistic? Are we going to get there?
We are super optimistic, John, because we have an amazing accounting department and they're going to make it happen.
I think, yes, I think our amazing accounting department is certainly going to make it happen. I think we've been as transparent as possible with folks so that that there's a lot of back and forth going on with us and the department so that this is done correctly. These specialists spent a lot of time trying to figure out exactly how these rates were structured so that when the rate increases could be, put in place, they're applied appropriately. And that really has required, oh my gosh, how many times do each batches go back and forth, do you think? I would say at least it's going at 2 to 3 times. Look at Gene says 10 times. I would say at least 3 formal times they are going back and forth between us and the department asking additional questions. The department also wants to ensure that this is done correctly as well. You know, we had a deadline of the 15th to get our changes in for the final, to confirm and to get the final changes in for our final batch, which was batch 4. I don't know if it's batch 4A, 4B, 4C, or 4D. Again, I apologize to all the staff that have had to deal with the confusion because the batches have also gotten renamed during the course of all of this rate study implementation as well. So again, we feel confident about it, but we want to share with you because we know it has come up in this meeting and we want to just, I think we'll probably talk about it every week briefly, is that there is going to be an appeal process that goes into place. And so Olivia, I think I'll share my screen. Am I bringing up the rate study implementation section on our website, on DDS's website, and then you'll let me know if I'm navigating correctly from there. So
Sounds good.
On DDS's website and we want to go to the rate study implementation, correct?
Yes.
And then we want to go to the rate review process, correct?
Yes.
And right here, there's a letter and it's rate adjustment effective April 1st, and it's the rate review process. Now, I am also going to copy this directly into the chat so that if someone wants to look at this, they don't have to follow all these steps. But as always, we like to make sure that you know where to get the resources yourselves without having to be reliant on us holding these meetings every week. Even though we do, and we're happy to share the information, we really want to make sure that our service providers are involved and aware of what is going on and where to find that information. So I am going to make my screen look a little bit bigger, and I don't know how much that'll help folks, but here is the letter, right, Olivia? And so why don't I have you go through this real quick?
Sure. So I think we talked about it when we had received the letter from DDS, but it hadn't been posted on DDS's website. So we just kind of gave a brief overview, but it just talks about if you disagree with your rate, when you officially get it, then you can submit the form below. Oh, John, we see your email now.
Not anymore.
Okay. If you'll keep going down, there's a form and it looks very similar to the alternative service rate review if you had questions about your alternative services rate. So you would fill out this information, why you disagree, what you think it should be different, submit it to the regional center, we will review it, and then if we have any questions, then we submit it to DDS. So seems like a very simple process. Once we can finally release the rates and you'll be able to review it and then see if you need to submit one of these forms or not.
So we want to make sure, well, so again, that's it. That's the whole form right there. It's just attached right there. So I'm going to stop sharing real quickly. So again, we want to ensure that folks are aware of this and that they know that they've got the ability to do this. What we talked about this morning, Olivia, was that this is keyed off of 60 days after receiving their rates. So it makes it clear you will receive that vendor rate file. Once you get that vendor rate file, that's when the 60-day clock starts for that. I have to think that the department's got to be very, I don't want to say that there's going to be a ton of leniency with the timeframes and stuff like that, but we as a regional center are committed to do whatever we need to do within that time frame to support you in making your request to DDS, as long as we agree with it. Like we really want to be on the same page, so we might need to be back and forth with you guys as well, because we obviously must have submitted some incorrect information previously, and we need to figure out what we submitted that was incorrect. So again, the regional center will hopefully be able to resolve this, but if we're not able to and it still needs to go to DDS, then obviously we have the process that's here. So we want to make sure that this is done correctly. I was listening to community services directors meeting yesterday, and there was still a lot that had some rates that were really, really off base as far as huge rate increases that did not appear congruent with other peers within the same service code or types of services. And we found out early on that was because there appeared to be some wrong ratios that were included. in the, like, they were just miscategorized. A 1 to 3 should have been a 1 to 1, that type of thing. And that really does impact and make changes to what rates would look like. And so, I feel like we did a really good job trying to get rid of all of those outliers so that there wouldn't be any, like, delays in essence in you being able to receive your, your updated rates. And so, again, it's all, I don't want to say it's all conjecture, but until you see it, you're not really going to know how it's going to impact you guys. But that being said, this is the process, and DDS is staying in regular contact with us. Olivia, how frequently are they still having those meetings with the regional centers about processing these?
We meet at least once a week. There's a meeting with DDS for all the regional centers. And then I know we've had individual meetings with DDS to discuss certain rates or service codes.
I feel like our individual meetings have also been about once a week over the last 6 weeks or so, where we've had, with someone over at the rate section over there. So again, just saying all of this to illustrate that it's a huge undertaking to, like, drastically change all of these things. And it really does mean trying to figure it out and be accurate. And so, again, we're doing our very best. We certainly will want to work as closely with you all as possible if there were mistakes that are made. And so we'll just be, looking forward to the rates being released and kind of go from there. This is a great time. If you guys have questions specifically about the rate study, you've got a bunch of specialists on here and our managers. So any other questions about the rate study, you're welcome to put it in the chat too. Service providers, all right. Thank you. All righty. So the next thing I wanted to touch on was, I guess I want to talk about the closure of training towards self-reliance. And I do want to touch a little bit on just some of the stuff that came up during our first public meeting. And we have another public meeting coming up today. And it's stuff that I've been familiar with over the years, but I feel like it's kind of worth discussing. So in a situation like we had with training towards self-reliance, TTSR, where, we in essence, well, not in essence, we had 4 business days from when we received the written notice that they were closing, that they closed. And that's one of the questions that came up from clients and families in the meeting was, is this a common practice? Is this something that would typically happen? Like, we can't go through this again. You can't make us, because we're talking about people that have, independent living services, day program, etc. And so we talked about regulations. We talked about giving 60-day notices about, closing programs. But in situations where we have someone that's going out of business, we don't really have the ability to hold them accountable to any of those promises per se that they've made. And so in this case, we decided that we would host a public meeting so we could talk directly to the clients and the family members and the support people. We had a number of TTSR staff that were in the meeting yesterday as well, and our former staff, I guess, or whatever. So with that being said, for us, it was good to be able to connect with our clients and to hear about what their concerns were. One of the things that was frustrating, which has not been uncommon in my experience in the past, is that there was a number of complaints that came up about the programming that they've been receiving. Complaints about day programming activities, complaints about switching to a more community-based model instead of a more site-based model, and how that really didn't meet the needs of a lot of the callers that were on the phone, and or excuse me, in the Zoom meeting. And so for us, we really wanted to focus in the discussions with the clients and families that, it's sad when you lose a provider. For us, losing a provider that's been around 40 plus years, that's worked with literally generations of families that were on the phone, in the Zoom meeting yesterday. It's devastating to lose that, but also to look at it as an opportunity to really be able to articulate what you want for a service, really be able to talk about what you need as far as supports in your service, and really being able to share with the service coordinators what your satisfaction is about the service. And so it's very frustrating when we hear, loud complaints about things in essence after the fact. And so just know that, we, Michelle Johnson and I met about it this morning, and we're certainly looking at ways where we can look at the satisfaction that folks are having with the services that we're receiving, because I don't know how many times we said yesterday that we empower people. to have this discussion during their planning team meetings, but we know not everyone does. And you as service providers know this too. Not everyone is willing to talk about the issues that they have with programs. People are afraid of losing what they have in many cases. And so, again, it was kind of anytime I do any big focus group or any big public meeting, it really helps center, I think, a little bit why we do what we do so that we really understand the importance of when we're providing these community services, that they really have to be meeting the needs of the individuals, and that the clients and the families are not always willing to articulate that it's not meeting their needs. And I think there was certainly a lot for us to take away from it when it comes to people's idea of creating an HCBS compliant, fully community-based type of day programming opportunity, because the way in which folks felt that was being delivered to them was very different than what they felt their needs were. And so again, for us, when we have these closures like this, where there's really no notice, we feel like it's imperative to do the process that I think we may have described briefly last week, where Jean or Olivia's staff will look and see who's attending the program, look at who's able to take new referrals, try to connect those clients with those other service providers. It's unfortunate when we have to do that, and we have to do it in such a rush because of the short notice that's given. But I do appreciate all the work that's being done by our service coordinators and managers and everyone to make sure that those clients don't have like gaps in their services. I mean, it's certainly not fair to our case management staff as well to have like no notice and have to do that. And you guys have to kind of pick up the pieces and try to help out folks so that they can continue to be served. So that's just a little update about kind of what's going on about TTSR and kind of some of the feedback that we got in that public meeting. And I'm glad to see that a lot of clients had already been contacted by their service coordinator. Some of them said, oh, I'm going to start this new art program, or, oh, I'm going to the Milieu Center now. One was very excited that she was going to be able to go back to the Milieu Center, and was encouraging her peers that were looking for a program because she loved attending there. So again, there's a lot of benefits to having these types of public meetings, but more than anything, I think for us to kind of get a real reality check on what people have to say about their services that they're receiving, and also their comfort level in describing whether or not the services are really working for them. So we certainly hope that all of these individuals have successful transitions into different ILS programs, into different day programs, into the different parenting support programs, because those were the three programs that TTSR had. I don't know if there's any questions about that, but just kind of wanted as a community to kind of share with you guys what's going on. That's a large Sacramento area provider, to lose, that's been around, forever. And so again, devastating when it happens, but we're really trying to frame this as opportunities for clients to look at other things that they might be interested in, maybe things that have changed since COVID as well, where people's interests lie. So. All right. Anything else? I don't think anything else about TTSR, Olivia. No. All right. We have, let's see, again, wanting to share with you information from the Department of Developmental Services. There was a DS task force meeting that was held. And so let me just real quickly show you where you can find information about the Developmental Services Task Force. So if you go to the Developmental Services Task Force and you go to past task force meetings or past work group meetings, you can find out the information. Again, if you look at DDS's calendar, you can also find out when these meetings are going to be held. They're usually about 2 hours. And right now there's monthly updates that are being given on, in essence, different initiatives that are being put on by the regional centers, by the Department of Developmental Services. So again, there's a PowerPoint that's available here. If you are so inclined, you can also watch the meeting recording of it as well, which will pop up on Zoom. And I don't know if I can open up Zoom and WebEx at the same time, but it's right there. So if you're interested in that, you can click on that recording as well to see what the DS task force shared. Again, right now we're at a point where we're readying ourselves for the May revision, and so that's going to be coming up here in the next about 3 weeks or so, and we certainly will spend time giving you all updates on what the May revision is going to look like to the state budget and what are the new things that are going to be included in there. So with that being said, I do want to go over to, let's see, residential vendor forum. We've got a residential vendor forum coming up.
We do. We have a residential vendor forum coming up on Thursday, May 26th at 9 a.m. And if the invite has, I don't think the invite's gone out yet, Odelia, has it? Oh, it has? It already has. Awesome. Even better. So if you have not received it, feel free to reach out to your specialist and they can forward you the invite. Otherwise, we will make sure it gets sent out again next week when Christine Hobbs, our office assistant, is back in the office.
Excellent. Thank you very much. Again, we always encourage service providers to participate in the vendor forums. We don't get a ton of residential service providers that have the ability to log into these meetings. Certainly don't have a ton that participate in our provider advisory committee, but we always get a good turnout for our residential vendor forums. Odelia comes up with a fantastic agenda, and you know, we've done I think a very good job in making sure that we create that availability. Let's see, what's the chat here? The date, residential vendor forum is May 26th at 9 a.m. And I believe that we are going to be holding I think moving forward, the reality is we will probably offer a virtual option or at least a hybrid option for every type of like community facing meeting like this, just because we love the attendance that we get from having this option for our service providers. Especially those service providers that maybe can't get out of their care home, you know, to drive down to the regional center and things like that. So it's also nice, you know, again, you know, having, you know, it's convenient for our managers. They can log right in. So anyways, that's coming up May 26th. I got to make sure it's on my own calendar, and we will look forward to meeting with our residential service providers. I will say, in the same vein of this, I was meeting with a few different of the managers this week and talking about a presentation that I gave to the 6beds.org group. Some of you are familiar with them. 6beds is growing in size as a group that lobbies and is kind of a trade group for residential service providers all throughout the state of California. And they invite me to their conferences to speak, and I had an opportunity to speak earlier this week with them. And one of the things that I discussed, and for those residential providers, you know, any of our providers, we've been working off of modified quality assurance activities since COVID started. So has community care licensing, but that's all going away or has already gone away. And so with that being said, I fully expect, and this is what I shared statewide, that we're going to see an increase in things like substantial inadequacies being cited. We're going to see an increase in things like sanctions occurring in our facilities. It is an impossibility that you can go from having the type of oversight and reviews that were going on and then have it shift so, you know, wildly during COVID and concurrently have so much turnover in staff and not have things that in essence end up coming back up when we are back out doing those in-person evaluations. It's not a negative thing, and we should not be looking at this as a negative thing. This is a reset back to, in essence, where we were previously when we changed the, you know, quality assurance rules for COVID. But again, we are back at it. With that being said, though we are starting to hear reports from service providers that they are getting more applicants for positions, many service providers are still really, really struggling to be able to hire for a lot of those positions. And so we really want to be mindful of the challenges that service providers are facing as they come back out of, you know, COVID and we get back to, excuse me, what those quality assurance activities really were like prior to COVID. We understand that, but we also, again, have that responsibility that we've got to conduct evaluations of all of our homes. We got to, you know, take a look at our programs. We have to make sure that people are providing services that are in line with their program designs and in line with regulations. And so I know that there's a lot of activity that's going on right now as we get into the summer months. I certainly expect that we're going to have, you know, a whole lot more in the QA world. And so again, you know, issues and things like that get brought up out of these things, please make sure that you connect with our managers. You know, if you have an issue with any facility liaison, if you've got a SLS issue and you know, you want to touch bases with Carol, like, please, we want to ensure that you're getting communication. We want to ensure that, for our new staff, that they are being trained appropriately to do their jobs. But Alta also, just like every other sector, had the same turnover. And we are, training and retraining staff on how to do things. And so let's, as we did with COVID, as much as possible, get through that together. I'm hoping that we can get out of COVID together as well and still remember the things that kind of brought us together during COVID, if that makes sense. Like we saw amazing things out of service providers during this period of time. I cannot count the number of times that service providers personally responded to requests by me to help out other service providers. And so just know that that is, and the relationships that we have, that is the type of things that we want to see maintained. Because as you go through the struggles of being a service provider, you need to know that you've got a partner in the regional center. And I've been talking about that a little bit this week too, about how, it's good to have a service provider that can truly be a partner with us, and us not having to, in essence, have a, social worker client relationship with our service providers. That's not how, we want to come together to come with solutions to problems. And we don't want to have that kind of us versus them mentality. So just again, be communicating to managers when and if you run into issues with individual employees. Don't let these things like fester and last long periods of time. Like, let's get it out. Let's talk about it. Let's figure out what needs to be the next best step forward. But again, with this full speed return back to kind of the QA world where we were at before, we certainly recognize that there's people are people still have a lot of anxiety about what's going on right now. There's still a lot of challenges that people are facing within their own families while they continue to try to be professionals and provide support to people with developmental disabilities. So again, deep mindfulness of that with us, and a hope for that ongoing continued positive relationship. Alrighty, let's see here. So residential vendor forum, 6 beds. So the other thing I wanted to share, and I don't know if what time it'll be over with. I don't know if I'll be able to click over to it or not. But right now, concurrently to this meeting, there is a meeting going on with some legislative staffers in support of the California Dental Association, and they're making a budget ask of $50 million. And they want to take that money and they want to give it out in grants to people that want to open specialized dental clinics for people with developmental disabilities, or dental operatories. So like a hospital, surgery center for people with developmental disabilities. And so the California Dental Association reached out to Alta California Regional Center, and one of Jean's staff, who has joined us in this meeting many times, Kelsey Rainey, is actually presenting to some legislative staffers today. She sits on our dental committee, and she is sharing her stories that she's gathered over her time helping service coordinators navigate this for their clients. And so she is sharing those stories and talking about some of the challenges that have been faced by our clients in trying to get their dental needs met. And so for us, we are more than happy to advocate for something like that. And I'm very pleased that we have one of our community services specialists that is so knowledgeable about the challenges that she's, we certainly trust her enough to go speak in front of a bunch of legislative staffers. And those legislative staffers, for those of you that are familiar with, kind of how things work in California, term limit state, are very influential. And so I'm very pleased to hear that we have this opportunity. She'll be joining others that are also providing testimony today. And we're hoping that this is something that becomes a reality. And we certainly appreciated the California Dental Association prioritizing people with developmental disabilities and those services. We do have a open date for Alta's clinic scheduled for May 2nd as well. And we'll try to get more details out about that. Jean, go ahead. Yeah.
I had it on my phone and I was half listening. She's did a great job.
Oh, good. Excellent. So it really is
Perfect.
going on right now. Perfect. Yes.
Perfect.
Yeah, I think it would be good, and again, for service providers as well, Kelsey put a great presentation together, and it might be something that you're interested in as well. If you have staff, especially on the residential side of things, and you're not familiar with some of the challenges and trying to get dental care for like your residents and things like that, or maybe you're very familiar with it. But again, I think we've got some good materials that were put together related to that. So very pleased to have Kelsey providing that. CDA presentation today. All right, and let's see, I'll check in the chat. Is there any update on the emergency staffing registry? I think it was last week that it was discussed that it was starting up. Are we able to share that information with service providers for their staffing issues? Yeah, so we are working on getting the final contract language all sewn up for that, and then we're going to be doing some public notices for our service providers, along with the YouTube video of the presentation that was given last week. So the YouTube video should be posted by today, I think, from last week. And so we'll get that out next week, a recording of the video widely for our service providers. And then obviously we've got the contact information on that presentation that shows folks how they can get involved and get started on the registry. So again, that'll be coming out shortly. And as always, we will make sure that we inform our staff internally when we are going to do a big mailing like that out to all of our service providers about the registry. Any other questions about the registry? No. Social recreation. Gene, I guess we can just say that we are plowing full speed ahead. We appreciate the feedback that we got from service providers after they participated in the ARC webinar last week on social. Was that last week? Yeah, last week on social recreation. They still have not posted the webinar yet on ARCA's website. And so one thing that we did share was that once we receive that video of the webinar, we'll send the link out to everyone that's signed up on our website on the MailChimp server. So just bear that in mind. We'll be getting that webinar information out there. One thing that was encouraging to me was that two of the respondents that we received from are people that currently run day programs. And so for us, that's great. We had just spoken with a provider that runs a day program, thinking about offering, a social recreation opportunity. And so to get, a couple responses the next morning after the webinar from two of our day program providers wanting to look at doing things is very exciting. So certainly are interested in doing that. And if any of you participated in that webinar and you have an interest in it, we did send out, with the advertisement for the webinar, where to find the letter of interest page on our website. But as always, I would like to share that with folks so that folks know where to look. So I am going to go here, which is our website on the front page. And if you go to, I like to just scroll down. Whoops, no, I don't. But I scrolled too far. There it is, service providers. So if you go to service providers, and then right here, they have become a service provider, and you can click on that, and it's got the information right here. And you can click on the letter of interest right here, and it'll show you what a letter of interest looks like. It shows you the things that need to be filled out in here. Pretty brief, but this allows us to ensure that we know which staff we need to assign to working on these things. So again, would encourage you guys, if anyone does have an interest in that, you're welcome to call, and you can call and talk to Jean if you want to. She can hook you up with one of her specialists. But a letter of interest is always a great way for us to kind of get things started, especially when we receive so much interest from different folks about things, and it's kind of tough to track it via voicemails and emails. It's a lot easier for us if a letter of interest comes in, and then we can get assigned to one of our specialists like right away, because you don't want to wait to schedule a meeting with me to talk about your social recreation program, because you're going to be it's going to be out a ways. We want to get you in with a specialist and make sure that you guys can get your questions answered. And please believe I'm intimately involved in these meetings and these discussions and things like that with our staff, and trying to provide the best guidance possible on how we can increase these opportunities for social recreation in our catchment area. And again, we're talking about camps as well. We certainly have an interest in that too, all the non-medical therapies. So looking forward to more and more interest in that coming in. We certainly want to provide a lot of opportunities. Really would love to get some camps as well for our folks. When we're talking about the HCBS aspect of these things, we're talking about inclusion. That was a big aspect of the social recreation webinar. About a half hour of it was talking about inclusion and kind of where we look at that in 2022 compared to where we were at with social recreation programs before the services were suspended. And so for the social recreation programs, we're really looking for opportunities for our clients to be able to participate in the same programs that my kids get to participate in, and people that don't have developmental disabilities are able to do. And a good example is we met with the city of Sacramento and went over their whole catalog of different classes that they have and trying to figure out a way so that we can vendor them so that we can get our clients, into those different types of opportunities. When it comes to camp, we recognize that that might be more of a segregated setting, and that is the reality of it. So for those ongoing, maybe long-term type services, like some of the social recreation things, we are truly looking for that integration, for that full inclusion to every extent. But when it comes to the camps, we recognize that we will support as a regional center people that are going to camps that primarily are serving people with developmental disabilities. And also mindful that if there's transportation that's needed, we can also help support transportation to those camps as well. Any questions about social recreation or camps? All right. With that being said, I only have one more agenda item, unless Jean or Olivia have anything else, which is and Hewitt doesn't know that I'm going to do this, so this is my favorite part of the day. So Hewitt is going to be coming next week, and he's going to be talking about what, Hewitt?
Emergency preparedness.
Emergency preparedness. So remind Hewitt, everyone, what your position is here at Alta.
I am the emergency coordinator here.
He is our emergency coordinator. So he likes it when it rains. We hope it's not a thunderstorm that causes lightning and a fire. So I will be turning the reins over to Hewitt next week. He's going to be talking with you guys. We're going to be doing we'll send out a flyer like we typically do when we have a special meeting where we're discussing a specialized topic. And I think Hewitt wants to give you guys some 2022 up-to-date, guidance and support as service providers when it comes to disaster planning, emergency planning. And so he's got some dynamic stuff to discuss with you guys about next week. And so we'll be looking forward to that. The plan is going to be that we are going to try to kind of bring in some different folks to be talking about things with you all. And, whether it's our internal staff, we might have, Carly do a discussion on employment opportunities for some of you service providers that aren't as familiar about some of the different employment opportunities that are available for clients, in our catchment area. Or maybe have Carly talk about what her vision is for the future of employment services within our area. There's a lot of ways that we'd like to get some of these specialized positions involved with you as service providers. Jean?
I was just going to do a plug for Hewitt. He knows this stuff. He's got a lot of experience. And so he's laughing at me. He's got it. So that'll be a very, I think that presentation is going to be really worthwhile.
Yeah.
Can I do an ageism? He looks young, but he's got a lot of experience. So
thank you, Jane. Yeah, we definitely want to ensure that our folks have this information. And again, Hewitt's got the DDS kind of started off with like a trickle, and now there's just like a lot of stuff going on with his position, lots of expectations that they're putting along with it too. And so again, I think this is a great way for us as a regional center to utilize this position as a way to support you as service providers in developing your plans. Again, much better for us to have this discussion, hopefully up front, more preventative of nature, rather than us meeting with a provider later on that, went through something that maybe unfortunately they didn't have to if there was better planning that had gone in place. So just recognize that we're here to put these resources out here, and we certainly appreciate Hewitt offering that opportunity for everyone. All righty. Oh, Heather, do I see a hand? Heather, go for
Yeah,
it.
I wanted to also see if you could put a plug out there for the RFP orientation next week.
Ooh, well, why don't you put a plug out there for the RFP orientation next week?
Sure. So on the same website that John was just on, where to become a provider, we also have information on our upcoming RFP orientation, which is going to be held next Wednesday, the 27th at 2 p.m. There are 3 projects that are up. We have a crisis support services mobile crisis staffing response. Oh, perfect. Thank you, John. A group push-in as well as a CCH. So there will be more information during this, and it is right there. So this is done both hybrid and as well as in person. So if you have any questions, you can email the rfp@altaregional.org mailbox, or you can even email me. There you go.
Excellent. So thank you very much, Heather, for that. I'm going to stop sharing my screen, but we are offering a hybrid. We will be there in person if you guys want to meet with us and talk with us about it. But we certainly are going to have the WebEx or the Avaya version available as well for people to log in. So looking forward to that. Again, we are very pleased that the Department of Developmental Services has given us the opportunity to develop these projects. They, give a lot of faith in us. There's only going to be this year the development of 2 group homes for children with specialized healthcare needs in the state of California. There's going to be one at Alta, and there's going to be one at Central Valley Regional Center. Those are the only 2, if someone is interested in doing one of those projects, that are going to be doing that model, at least to start in the state of California. And we certainly don't mind Alta being the regional center that pilots some of these things. We've done that in the past, and for us, it means things like not sending our kids to Los Angeles to some hospital or to the Bay Area to some place, that we can have them locally near their family members, and still get their healthcare needs met. Like I'm very pleased that DDS created this model and that we're going to have an opportunity to be able to RFP for it. So it's 11:45. Some of us have a public meeting to attend for TTSR at noon. So thank you again, everyone, for attending, and really appreciate it and look forward to talking to folks. Have a great weekend. And thank you again, all the Alta staff that came in on as well today. Bye, folks. We'll talk to you later.